Hi, everybody. It's Dean Hutchison here from Circle Surrogacy. I'm just gonna open it up so everyone can get in, but I'm gonna leave the room. We're not gonna start it for another couple minutes, just so as many people that want to be on it can start from the beginning. It is recording, so if you have to leave for some reason, um, don't worry. You'll get an email of the recording afterwards. It usually takes about 24 hours to upload and be sent. Um, any questions you have, and I'll go through this, you can put them in, there's a written place, so you won't be able to talk, but you can write questions and we'll answer as many as we can. But I just wanted to say hello, and we'll be right back live, probably in about 2 minutes. Thanks. All right, so I think we'll start. So again, for those of you who just recently joined, my name is Dean Hutchison. I am the Vice President Director of Legal at Circle Surrogacy. I may have consulted with some of you, and for those of you who I haven't, thank you for stepping on board to listen today. I know some emails have gone out with a kind of breakdown of what we're doing at Circle and how we're working through the issues we're facing with COVID-19, but we wanted to also have a kind of live chat. Today, you'll be hearing from three of us, and we'll try and answer as many questions as we can. Probably will go for about an hour or so, or less if there's not as many questions, but I already introduced myself. Also on the call will be Dr. Saeed Daneshmand, who is an IVF physician at San Diego Fertility Center, so he can answer potentially some of the questions regarding medical issues and IVF issues. And then our president, Sam Hyde from Circle, will also be on to speak. So I just wanted to begin by saying, obviously, I hope all of you are doing well and staying safe and staying sane amongst what we're going on right now. Um, it is obviously a challenging time for all people. And I think, it's instead of cursing these challenges, is trying to find the light to get through them. And I've been, and probably Dr. Daneshmand can speak for San Diego Fertility, but overly impressed with how amazing everyone on our team has jumped into cases, have tried to find breakthroughs and get workarounds to help all of our parents that are currently in the program, as well as find ways to assist parents that are joining to kind of assuage any fears about what's going on. It's been a pretty amazing thing to watch. We have daily, usually twice daily, full staff meetings talking about what's going on. We meet individually in our teams and everything just to talk through each issues and to see if we can help problem solve. So for this call itself, you are in listen only mode, so you can't speak back and forth to us, but there will be, if you look on the right side, there is a question box after kind of the opening intro salvo. You'll be able to, you can start writing questions immediately, and we'll do our best to answer them. As this is a very fluid situations, we'll try and answer questions as best we can, but some of them may just be, what we're seeing now, and it could change 24 hours from now. But we'll do our best to answer everything as it comes. This is recording, as I mentioned earlier, so if you need to leave, you can sign in and just get right off, and it'll come in, or you can put your couple questions in you may have, and then we'll answer them, and you'll get a recording of this probably either later today or tomorrow. So that's kind of the little background stuff. So as I mentioned earlier, we totally understand that this is a very uncertain time. Probably the most unprecedented time in my lifetime, obviously. And as a surrogacy agency, we've seen all things come and flow. We've had dealt with issues where it was tough to get people rights and tough to get people get back home or get their own citizenships. But this is kind of striking in a different way. Obviously, our primary concern from day one is our safety and comfort of all of our parents, our intended parents, our surrogates, and our egg donors. And we've been working feverishly with them to find the best things, best outcomes for all of them. We are following U.S. government Central Disease Control, so CDC, for latest news. We're watching all developments about COVID. We're working with our clinics. We're talking to ASRM. I helped put together a 300-person surrogacy professionals webinar the other evening, where a lot of different agency owners, attorneys, psychologists, doctors spent about 3 hours together on a webinar just discussing what we're seeing around the country and how to help our clients, and everyone kind of giving their different opinions. So it is both a domestic and global strategy where we're all working together to find the best route. I don't know, before I get into some of the questions, I don't know, Dr. Daneshmand, if you want to just jump in from the medical side, just to kind of provide, what your clinic's doing and what you're seeing, and what the advice is from a medical stance.
Thank you, Dean. Hello, everyone, and hope you're keeping healthy and safe. I know these are, as Dean said, unprecedented times, and it's really been impressive. The community that we're in has really come together in regards to supporting one another, being available, and keeping the lines of communication open. I think that's really what's important during these difficult times, is that both Circle and our center are always available to you for any communication. Obviously, you guys can call me, text me via cell. You should have my cell phone number, and I'm available to answer all your questions and concerns. I think there are several sort of layers of concerns that intended parents, surrogates, egg donors have during these times. I guess we can start off with those surrogates that are pregnant, whether there is any evidence that if they were to contract COVID-19 virus, whether there's any evidence of vertical transmission, meaning transmission from the surrogate to the fetus, or a pregnant patient to the fetus. And we call that vertical transmission. And there's no evidence of that at this particular point. There are different corollaries with different viruses in the history of infections, and much like other viruses, there's no evidence of vertical transmission. In fact, there was a recent study published in the journal Lancet, very recent, and just in the last couple of weeks. What they did was they looked at, in fact, this was a publication from Wuhan University, and what they did was they followed and examined pregnant patients who had come to the university with pneumonia and who were diagnosed with COVID-19. They then looked at the cord blood, the amniotic fluid, and then once the babies were born, they looked at nasal swabs and oral swabs to see if there was any evidence of transmission of the virus to the fetus or to the newborn, and they didn't find any. So some good news coming out of Wuhan University in regards to vertical transmission. Now, if a pregnant patient, if a pregnant surrogate were to develop COVID-19 and were to have severe symptoms, there's some evidence in the literature from previous viral infections that could potentially increase some complications during pregnancy. For example, in the first trimester, there's some evidence for a slight increase in miscarriage rates, and during the pregnancy itself, there's some evidence for preterm labor. If the symptoms of a viral infection were very severe, that meaning that there's pneumonia, problems with respiration, But I want to just make sure that I state that pregnant patients are not more prone to this particular virus. In other words, they don't have a higher chance of contracting it, but if they do contract it and they have severe symptoms, then that could pose some complications during pregnancy. The other concern that many of you may have is, well, if we're going through the IVF process and sperm and eggs are being used, then is there any evidence that the sperm could harbor the virus, the egg, and then subsequently that could find its way to the embryo and to the pregnancy and to the fetus? Well, we have very good evidence that that's not the case. There's no evidence that the sperm, the eggs, or the embryos can harbor the virus or transmit the virus to the fetus. We have great studies, solid evidence for this from other viruses, for example, hepatitis viruses, other coronaviruses, that the sperm and the eggs, especially with the stringent washing techniques that we have, that's not going to be transmitted. So that's not a concern of ours in regards to creating embryos. The other concern is just one of public health. The American Society of Reproductive Medicine has recommended for us to delay the initiation of IVF cycles and delay frozen embryo transfers up until March 30th. And at that particular time, they'll give us further guidance. And the reason for that was just a public health concern. They're trying to decrease, obviously, the traffic through fertility clinics. And also the concern is that if a patient is pregnant right now and they were to have severe symptoms, some of the medications that may be used in the future to combat this particular virus may not be available to pregnant patients or may not be indicated because of the pregnancy. So these are some of the concerns I think that some of you have expressed to us at the Fertility Center. Again, we're always available to you to answer your questions and concerns. I'm proud to be part of this surrogacy community with these incredible colleagues that are really are stepping up during this time of crisis to help intended parents, egg donors, surrogates answer their questions. And obviously on top of our mind is always their health.
Thank you, Dr. Daneshmand. And I'm sure there'll be questions that'll come up. So obviously some of the questions that we've been getting, and I want to say, if your questions don't get answered today, or if something comes up later, I know if you have already consulted with people at Circle, obviously reach directly to them back after today. If they can't answer the question, they'll get answers for you. So don't feel like this is your only chance, and we'll try and do these regularly if we can moving forward, so that as this progresses, we're still in constant contact. So there's questions about should people delay beginning their surrogacy journey. This is also a very personal question to you, so it's very subjective. What we've been telling people is, even people that sign on tomorrow, for the most part, wouldn't be matched with a surrogate from a 3 to 6 month period anyway, and depending on requirements and specific needs for your match with your surrogate, it may be even longer. So, if you're definitely still feel like you're going to do a surrogacy when if all plays out well, it's not a huge negative to start the journey now. You'll be doing a lot of the background work. You might not be able to get through the IVF. Some of you may already have embryos created though somewhere, so it's not going to impact it. And hopefully by the time you are getting to that matching stage with your surrogate and then progressing towards a transfer, things have changed. So it's obviously we respect anyone's decision, but it's not completely barring to starting the process now. You're going to wait anyway. So there's no reason not to get going. And I don't know if Dr. Daneshmand can reach if there's any medical piece that can be done, or at least some maybe pre-screening closer to their homes if it's allowed, how they could advance their IVF process if they started sooner rather than later.
Yeah, I think, I think every fertility center will be sort of different in their approach, or many fertility centers will be different in their approaches in terms of whether they're going to continue diagnostic screening or they're going to initiate IVF cycles. But yes, there are certain aspects of the surrogacy process that can continue until such time where we can now go ahead and resume preparation of the uterus for embryo transfers. I think that the travel restrictions and sometimes some of the restrictions within states about movements could impact some of this. And of course, again, we want to make sure that there are stringent protocols in place at the fertility center. For example, we have a screening process at our fertility center prior to anyone entering. Only patients are able to enter, but they also have to go through a screening process first before they enter the clinic. We are trying our very best to adhere to the social distancing policies that are going to decrease the transmission rates of this particular virus. I do think that probably there will be a pause in some treatments, for example, initiation of IVF cycles until about March 30th. And then the hope is that after March 30th, that those cycles can resume. Of course, this won't have any impact on, for example, if you're going through an egg donor IVF cycle, won't have any impact because your egg donor can stay on a birth control pill. And then as soon as we resume, she stops the birth control pill, and then we can start the IVF cycle.
And a couple that people have asked about the travel bans, particularly international couples, how will it affect? I mean, obviously we can't know what's going to happen in the future in terms of the travel bans. The hope is as the pandemic recedes that travel will open. I mean, technically, for international couples, you're really only having to come to the United States twice, sometimes try and add a third trip. But usually it's for your own IVF processes and then the birth of the child. And then obviously a lot of people like to come once during the pregnancy to meet with their surrogate and potentially go to the scans. So in the short term, there isn't really much travel necessary. It may, as Dr. Daneshmand said, may impact a little bit of the start or the initiation of the IVF process. But as I mentioned earlier, you most likely wouldn't be matching anyway with a surrogate for some time. So potentially those travel bans will have lifted by the time you're making that travel. Questions about what are we currently doing to support intended parents, surrogates, and egg donors. I mean, our teams, the social work teams, the PC teams, the legal teams are in constant contact right now, particularly with our international parents that are currently under travel restrictions. This really started back in January with China, and we had a handful of Chinese intended parents that needed to come. All of those through births through May were able to get into the country in advance of birth. So, we helped and kind of get the word out, and they made plans and got here or found ways to get here if the travel ban was in place. Similarly, once it started to look as though Europe was going to have a similar ban, we kind of immediately got into play with our parents that were due through first through April, then May, and now we're starting to reach out, or already have, but parents in June, July, and August just to be safe, to try and find, what's the best process. If you can't get here, what can we do for the birth? We've made calls to consulates, to the immigration, to other lawyers, to immigration attorneys, to whatever we can do to assist in the process. Similarly with surrogates and egg donors, the social work team, their coordination team have been in constant contact with them as well. So as questions come in, if fears come up, we want them to have someone to talk to at Circle. We've always felt that one of probably the most important part of this whole process that sometimes gets swept under the rug is the heavy screening that's done initially to make sure we're finding the right intended parents, surrogates, and donors for our program, but also that mental health support that's provided throughout the process. So everyone's kind of fully engaged, working as hard as they can to assist in those cases. I don't know, Sam, if you wanted to jump in as well there.
Yeah, absolutely. I would just say, I think for me, it's been just incredible to see the amount of engagement from all of our team members to help our current clients navigate this situation. And I think for for parents who are considering a journey, the ability for a large agency or a really experienced clinic like San Diego Fertility, situations like this are why you end up choosing an agency like us or a clinic like San Diego. That if you have a super smooth, easy journey, many agencies can handle that. I think it's when the complexity comes up that an experienced agency and an experienced clinic really prove their worth. And it's been great to see the team on both the Circle side, but then also on the San Diego side, and some of the other big clinics that we work with, really just jump in and be just completely solution oriented on trying to find the right way and the right approach for both the parents, the surrogates, and the egg donors. So it's been incredible.
So some questions that have come in from current parents or current clients as well as potential was about hospital protocols. I'll skip that question because Dr. Daneshmand already talked about IVF, but how have hospital protocols changed for both international and domestic parents? So this is one that's changing day by day as well as hospital to hospital. It's probably, one of those things that makes you feel awful for the parents that are delivering right now that had this vision of this perfect everyone in the room and having a great time and sharing in this process. But we have seen hospitals limiting surrogates to one support person. Some hospitals have made the exception that the child also gets a support person. We've worked very closely in the cases where it seemed like they may not let either parent in to, talk to the hospital, talk to local attorneys, get everyone's involvement in almost every case right now. The hospital has, kind of relented and allowed someone in. The issue is obviously they're dealing with a massive potential liability of letting people in that aren't, strictly either the surrogate or one support person. So it is a place where, again, our our coordination team as well as social work team will work with the parents if they're not allowed in. The hospitals are still making a process where the parents can obviously get their child, etc. But it is something that's, it's depends on the hospital you're working with, depends on the state, depends on the particulars in each case. But we're helping parents work through that process. Will Circle be able to survive an economic downturn caused by COVID-19? I'll let Sam answer as well, but I can say, I've been with Circle now 16 years. We've seen economic ups and downs. Circle's over 25 years old, so it's been through, post September 11th, issues and travel issues and economic downturns. So it is in, my belief that it can, but I think Sam can speak better to that aspect.
Yeah, absolutely. So yeah, Dean's exactly right. Circle's been in existence now for 25 years or so. I think Circle has grown every year for 25 years straight. I don't know whether that's exactly true. I don't know whether we'll grow this year, given the COVID-19 stuff going on at the moment. But the financial footing of Circle is strong. We're backed by a diverse group of investors that are committed to the long-term health of the business. And so I don't have any concerns about being able to come through this, fairly unscathed, I think. So we're focused right now on just kind of hunkering down and making sure that the parents we have and the surrogates we have and the egg donors we have can continue on their journeys or complete their journeys. And I don't have any real concern about economic health of the agency whatsoever.
So one question we've seen a lot as well is what happens if I start my surrogacy journey and then lose my job. So, obviously that can happen in any case. And obviously we take things on a case-by-case basis. We don't want to negatively impact our intended parents when life situations get in the way. We've had parents that get sick also, before a journey starts or in the middle of a journey after they've signed on, so we can work through it. In the short term, for people that do really feel like they want to get going and think that this issue may pass but are still have some reservations, we have allowed for contract changes to simply say, if you haven't been matched yet, in a certain time period, and you want to leave the program because either the medical situation gets worse or a financial issue arises in your life, we are allowing a refund of, if not all, the overwhelming majority of what you paid to get in the system now, and then stay there until that happens. Our contracts are always able to be negotiated. So if there's terms that you would like potentially in your contract, obviously talk to the person you consulted with. They'll maybe draft a provision for you, or you can draft a provision initially. They'll review it and come back with potential changes. But we are open to assisting in these kind of times with anyone's fears. And then there's a question of how I can continue to receive updates about COVID-19's impact on surrogacy. I mean, we'll try and do as many of these as we can. We'll send out emails as things change. We have a page which I think we're populating now, which may already be in existence, which we can send out, and it'll be updated routinely as things are happening. I don't know if we have a site blocked on this on the slides, but we can get it out to everyone with the follow-up email, where we're dedicating a page on the web page to what's happening so people can check as it's going. But as I said, we'll probably provide routine webinars. We'll send out emails as well to keep everyone informed of what's going on in this COVID surrogacy world, what's going on with Circle during this period, et cetera.
And in regards to the IVF cycle, there was just something I wanted to add as well that may ease the minds of some of you intended parents. We've had some intended fathers who are not able to, or intended parents who are not able to come to the clinic for their sperm freeze. And I directed a couple of weeks ago my IVF lab director to give me our statistics for egg freezing and then subsequent egg thaw and blastocyst formation. And the good news is that when we look at the statistics, when you look at the conversion rate of fertilized eggs to blastocysts, that conversion rate at our clinic has been 65%. So that's excellent. And the survival rate on the eggs was 93%. So what that means is if some of you, because of travel restrictions, are not able to come to the clinic, any of the clinics that you're working with, in order to be able to freeze your sperm, do ask that particular question in regards to whether the option of egg freeze is a good option. In our clinic, that's something that we are doing. The success rates and the blastocyst formation rates are excellent. And so that has eased the minds of some intended parents who are not able to come to us at this particular point. So if we freeze the eggs can be frozen for as long as we want them to be frozen. And then what we do is once you are able to travel to us for your sperm freeze, we'll thaw the eggs, fertilize them with the sperm, and then grow them to the blastocyst stage, which is the day 5, day 6 stage. At that particular point, we'll either refreeze them again, or if your surrogate's ready at that particular time and the restrictions have been lifted, then we can go ahead with the embryo transfer. So that's some good news in case you're concerned about the travel restrictions not being able to freeze your sperm.
So I'm going to open it up now to questions. Let me see if I can just get this. So the only question right now, and as I said, the question box is on the right, so if anyone wants to ask any questions, feel free to add them. So this would be for the doctor, and I think I know the answer, but I'll let the doctor answer. Dr. Daneshmand, does the coronavirus have any Zika-like effect on babies, or is there any evidence of babies having issues post-delivery?
At this particular point, no evidence that the coronavirus has any Zika-like effects. Obviously, during this pandemic, which started off in Asia and sort of made its way west, there have been many cases of pregnant patients being affected by it. and we don't have any evidence at this particular point. Now, of course, larger studies are needed to further analyze the modes of transmission, the effects on pregnancy. But if you look at similar types of viruses, other coronaviruses, rhinoviruses, influenza viruses, there doesn't seem to be any impact. First of all, there's no evidence of vertical transmission during pregnancy from the surrogate, from the pregnant patient to the fetus. And we don't have any evidence right now that the children born from patients who were pregnant and who ended up having the COVID-19 virus, there's any residual effects or any effects on the fetuses or on the newborns.
Thanks. So anyone, if there are any questions, we'll keep it open for another couple minutes. If we don't get any questions, obviously, here we go. There's a question, do you expect rising healthcare costs in the US post-COVID-19? It's tough to say. I mean, every year our healthcare costs usually increase in terms of insurance premiums and deductibles. I can't say. I mean, yes, I would probably guess some raising healthcare costs, but I don't know if that will impact particularly surrogacy-related costs. But I would expect maybe some potential increase in deductibles and premiums next year based on the number or what the tests are costing and what the overall impact on the U.S. healthcare system is of this particular pandemic. Do we anticipate screening more surrogates, and do we expect changes in surrogate reimbursement costs? I don't know if Dr. Daneshmand, if there will be a particular screen for COVID-19 in the future, or it would be outside the usual screening.
This particular point, there are no plans to test for COVID-19 among surrogates. I think that the population that is being tested now is the population at risk or the population who has symptoms. So that's sort of the, and because of the limited number of tests at this particular point that are available, there are no plans in place for that screening. Obviously, we know that there are many people who are asymptomatic carriers who don't have any symptoms, but they can shed the virus, they carry the virus. And the particular study in China actually showed about 86% of patients who ended up having severe symptoms from COVID-19, including pneumonia and respiratory difficulties, actually contracted the virus from asymptomatic carriers, from people who were close to them, but who had no symptoms at all. And you see every day people having the COVID-19 virus, but not having, being diagnosed with COVID-19, but not having any symptoms. So that's a possibility. But again, if somebody doesn't have any symptoms and has a sort of this incubation period of 14 days with the virus, and during those 14 days, they don't have any symptoms, most probably what's going to happen is that they're going to develop some level of immunity to COVID-19, in which case that may be actually a good thing, because there would be a possibility that they may not be reinfected. Again, we don't know, because this is COVID, this is what they call a novel virus. And one of my kids was asking me, Dad, why are they calling it a novel virus? I said, well, because the DNA sequence of this particular virus that has not been seen before, and that's why it's a novel virus. So there are further studies that need to be done in regards to modes of transmission, in regards to the virus itself, its effects. But at this particular point, there are no plans to do sort of widespread screening of surrogates for COVID-19, unless there are symptoms, or unless there's exposure, or we feel that there's a risk there.
Okay. And then there was a question, do we expect changes in surrogate reimbursement costs? I don't think, I mean, I wouldn't think so in terms of this, but the surrogates obviously kind of pick their own reimbursement schedule when they come to us. So, but I don't see any issues or any changes to that. What happens if I join the program and the travel ban remains longer than expected and I can't continue for some reason? Do I lose money? So similar to what I said earlier, you know, if you're in that situation when you're joining and you're currently under a travel ban, you know, if you want to include clauses that give you certain outrights, we're happy to do it. There might be a small administrative fee if you lose, if you've completed some of the process and your team has worked with you and created things. But you know, we're always happy and amenable to change contracts to keep people further protected. Let's see. Can the 3-month discount deadline be extended? As today it was announced, US won't grant visas, meaning we won't be able to travel to the US anytime soon. I mean, it's one of the possibilities. I think it's come up. Sam can jump in too, but if someone was ready to move forward in the period and then they just were hesitant and then decide after, you know, it can be discussed then. I'm sure, you know, we've done it on other occasions where similar things have happened in people's lives. You know, I wouldn't say yes to everything, but I wouldn't say that it's not going to happen either. Dr. Daneshmand, should we hold off with the in vitae saliva kits?
No, I think you should actually send the in vitro saliva kits. Those are the genetic test kits to assess recessive mutations. We can get those done. It takes about 2 to 3 weeks to get the results. So I think that's a good idea, and that's sort of a prelude prior to confirming your genetic compatibility with your egg donor. So you can actually move forward and get that test done, just because it takes a few weeks to get the results.
Will the U.S. political climate affect future Chinese intended parents? I mean, I don't see. I don't think so. I can't make a full dissertation on that, but I would expect that it shouldn't impact that at all. You know, I don't know what's going to happen in the next election. It seems like, based on perceived bungling of this situation, it might hold strong for the Democratic Party, but I'm not a political columnist or predictor that well. So I don't know exactly what it would be, but I don't think it should cause an issue. It's a question: are surrogates or egg donors declining matches or delaying journeys? I don't believe there's been any matches declined, but the only delays have really come from particular from the IVF process, because ASRM, which Dr. Daneshmand had mentioned, is saying there should be delays. Then it's more of delays on journeys because they can't proceed to that next step. I think I would expect most matches to stay together for that reason, because they, you know, neither side can really match with anyone else anyway. I mean, they can match with someone, but they can't proceed to that next step until the clinic's cleared. So I don't want to prognosticate the future, but right now I don't see anyone delaying it for this particular, except that for medical purposes, they're being told that they should, you know, hold off on transfers.
Yeah, so just I'll chime in there quickly as well. So what we're advising folks is we should, you know, continue to move forward with the match as it's presented both to parents and to surrogates, and then there is obviously work that needs to be done from the time you match until the time you go to do a transfer. You know, namely the legal agreement between both parties, which I think Dean will attest to, usually takes a little bit of time to go through and make sure that both parties fully understand the agreement and are ready to sign it. And so we're continuing to go forward with matches, you know, do that pre-work and have that, you know, agreement ready to go and signed, and to get legal clearance ready so that once the clinics do kind of open up and begin normal operations, which, as Dr. D said, probably, you know, end of March, early April, that there's no further kind of hurdles to jump over. So I don't anticipate any issues from a matching perspective. As Dean said, you know, likely that you might not be able to transfer right now, but if you match today, you weren't going to transfer tomorrow anyways because of that work that needs to be done.
Yeah, I mean, I can say the one issue we've seen, and it all came to moot because of the decision of the clinics to kind of stop, was some surrogates were, their employers, if were taking a stance that if they traveled, would potentially need a 2-week quarantine when they returned home. So, that's one thing that was coming up. But again, as I said, once the kind of clinics made the decision not to proceed with transfers, it didn't really impact it in any way. And I don't know, I don't know if you would know, Dr. Daneshmand, but I'm going to guess, in terms of current parents, something that may be impacted as well is if a surrogate has a scan and the parents wanted to go to it, potentially those clinics also will not let third parties into the scan, in a sense.
And I think many of these delays could, as Sam mentioned, we may be looking at just 2 weeks, potentially, maybe a little bit longer, maybe 3 weeks. One of the major factors is obviously that we want to get to the world wants to get to that flat part of the curve where the number of new cases that are diagnosed each day remains stable or declining. And then I think that then those particular jurisdictions, those particular places, towns, cities, countries can feel more comfortable that they have a handle on the situation, that the healthcare system can provide the kind of care that they want to for those patients who are seriously ill. Some of this comes from the statistics and historical data that we have from, let's say, the influenza virus of 1918, where when the virus affected particular cities, in cities where there were still social gatherings, the number of new cases just exponentially increased every few days, and it overwhelmed the healthcare system. But in those cities where there was some level of social distancing, where large gatherings were restricted and disallowed, in those particular places, the number of new cases stabilized to a much lower number, and so that didn't overwhelm as much the healthcare system. And that's sort of the corollary for today, and the reasons why many governmental agencies and countries and governments are providing these recommendations for social distancing and closing restaurants and other businesses in order to prevent that from happening. So I do think that we will see the light once the number of new cases have stabilized or are on the decline, which actually has happened already. For example, in China, it's happened in South Korea. The number of new cases that they've had has stabilized and decreased significantly. In fact, the latest report from China was that the number of new cases that they had were all imported cases from people who had traveled from other regions. I think and those are the only ones that were had been diagnosed. So some good news coming out of China and South Korea that were affected. And also, when you look at a country, for example, like Singapore, despite the fact that Singapore is only about 81 miles from the borders of China, they were able to have a significant control over the virus with very low numbers of deaths and very low numbers altogether. They put these sort of stringent measures in place, and they were able to, I'm sorry, not Singapore, what I meant was Taiwan. I misspoke. In Taiwan, again, being 81, not Singapore, but Taiwan being 81 miles from the Chinese border, they were able to put many stringent restrictions in place very quickly, and they were able to really lower the number of new cases and the number of deaths as well from the virus. So we do have great information coming from many countries who've instituted these social distancing policies. And so I do feel hopeful and optimistic for the future.
There's a question, will there be less potential surrogate candidates due to the COVID-19? Again, this would be something we wouldn't know until the future. I hate to say yes or no, because we just don't know. I don't know if we've seen a huge downturn in applications at the moment, but it's something that the future will only hold. So it's tough to say yes or no. I don't think the fact that the virus is there is going to cause it, but I don't know if Sam, you wanted to jump in there as well.
Yeah, I can jump in. So we have not seen a significant decrease in the number of applications we've gotten from surrogates over the last 2 weeks. We've seen maybe about a 15% decrease. So not there's certainly a little bit, but nothing that is that concerning to me. I think as the situation kind of becomes more known and there's less uncertainty out there about how things will unfold, I think you'll see that probably pop back up to where it was. Even 15% is within kind of the normal month-to-month variations we see anyway, so it's hard to necessarily pin it directly to that, although I don't think it'd be a stretch to say it is. I think overall, the amount of awareness around surrogacy has grown, exponentially over the last couple of years, and so I think we're likely still seeing kind of the buoying effects of that, and I would anticipate those applications will remain strong through any type of scenario that we're seeing unfold. That's how I feel right now, at least.
All right, I think that was the last question. So I want to thank Dr. Daneshmand for jumping on and joining with us to give that medical opinion. I want to thank everyone who came and asked questions. As I said before, we'll obviously send this out, this recording, so you'll have it. We'll send you a link to our page once it's operational, if it's not already. We'll send you, obviously, we'll update our people in our system as any changes happen or any new information comes out. And if you're already in touch with someone at Circle from your consultation phase, if you've done a full consultation, then that's probably the main contact you should reach out to with your follow-up questions. And as I said, if they can't answer them, they'll get them to someone who can assist with the answer. But thank you all for being here. Thanks, Sam and Saeed, for being on the panel. And we'll be in touch in the future.
Thank you, Dean.